Hello and welcome to Working Wise, a podcast created and produced by K&L Gates. Each episode is designed to provide labor and employment updates and compliance tips to lawyers and HR professionals. We hope you enjoy this podcast.
Welcome to K&L Gates' Working Wise podcast series. My name is Nicole Stockey, and I am a partner in the Pittsburgh office of the firm's Labor, Employment, and Workplace Safety Practice Group. In this podcast, I, along with two of my colleagues, Melanie Stratton Lopez, an associate in the firm's Raleigh office, and Megan Moore, an associate in the firm's Pittsburgh office, will discuss employer liability during the COVID-19 pandemic. We will specifically focus on state and federal enforcement actions in the context of COVID-19 and how employers can take measures to avoid such actions and investigations. As COVID-19 restrictions ease in many locations across the country, businesses are reopening and welcoming back in their employees. In this changing safety and regulatory landscape, employees should be mindful of potential state and federal investigations and enforcement actions related to employee health and safety concerns. In this podcast, we will discuss how state and federal agencies have already initiated investigations into COVID-19 related allegations. This is especially true in the healthcare industry. We will also discuss the potential changing landscape and enforcement actions given recently announced OSHA guidelines. We will further discuss practical steps that businesses can take to potentially limit future enforcement actions and investigations. I will first hand it over to Megan to discuss enforcement actions to date.
Thanks, Nicole. To date, COVID-19 related enforcement actions at both the state and federal level have focused on clusters of COVID-19 in high-risk industries. However, as will be discussed in depth later, all employers should remain vigilant because federal enforcement priorities appear to be shifting to all employers, even those in lower-risk industries. State attorneys general have demonstrated a willingness to investigate clusters of COVID-19 in workplaces, especially in high-risk healthcare settings. In Massachusetts, the Attorney General announced an investigation into a nursing home's response to an outbreak that killed 76 residents and one employee. Similarly, in New York, the Attorney General is investigating allegations that a nursing home failed to provide adequate personal protective equipment to staff, causing COVID-19 to spread in the facility. Although these examples are both in the healthcare industry, it is likely that such investigations will increase as more industries return to work and additional infection clusters develop. Indeed, clusters may serve as an indication that the employer failed to take the proper health and safety precautions to protect its workforce and may result in an investigation or enforcement action. The government's focus on clusters outside of the healthcare industry is already apparent in state OSHA plan investigative activities. In Kentucky, an OSHA state plan is investigating a cluster of infections in a Kentucky school system where one employee died and 18 others were infected. The California Division of Occupational Health and Safety, another OSHA state plan, is also investigating a cluster of infections at a food packaging plant where 20 employees tested positive. Employers should be mindful of the potential for state and federal enforcement actions, especially as their employees return to work. Melanie will now walk you through OSHA's recent enforcement guidance.
Thanks, Megan. Based on recently issued OSHA enforcement guidance, these enforcement trends should continue. OSHA has signaled it intends to ramp up and broaden its enforcement activities as more non-essential employers return to work. The most recent guidelines explicitly targets workplaces with high volumes of complaints or COVID-19 infections, regardless of the industry. This means that employers outside of the healthcare and other high-risk industries should be mindful of the potential for state and federal enforcement actions if infection clusters develop. The original OSHA guidelines released in April 2020 prioritized fatalities and imminent danger exposures related to COVID-19, specifically in healthcare organizations and among first responders. This led to the focus in the earlier stages of the pandemic on enforcement activities in healthcare settings. Then, on May 19, 2020, OSHA released its updated interim enforcement response plan for coronavirus disease 2019. This updated guidance divides enforcement priorities based on the level of community spread in the area. For areas with significant decreased community spread, OSHA will likely resume non-COVID-19 related inspections, such as inspections of falls and electrocutions. For areas with continued elevated community spread, OSHA will continue to prioritize COVID-19 related inspections and will pay attention to high-risk workplaces, such as hospitals and those workplaces with clusters of complaints or infections. These revised enforcement priorities may be a result of mounting public and political pressure by labor unions and advocacy groups to issue an emergency temporary standard for COVID-19. The AFL sued OSHA on May 18, 2020, petitioning the D.C. Circuit for a writ of mandamus compelling OSHA to issue an emergency temporary standard for infectious diseases such as COVID-19. The AFL-CIO argued that OSHA was failing to meet its duty of enforcement during the COVID-19 crisis. As of May 29, 2020, OSHA had only issued one citation related to COVID-19 involving a Georgia nursing home that failed to timely report the hospitalization of 6 employees. Then, on June 11, 2020, the D.C. Circuit issued an order denying the AFL-CIO's petition. Thus, it is unlikely that an emergency temporary standard related to COVID-19 is forthcoming. However, at the same time, OSHA plans to expand its inspection efforts to include any workplace with high numbers of complaints or known COVID-19 cases. Additionally, OSHA has 6 months to issue a citation from the date it opens an inspection. Thus, it remains to be seen whether additional citations will be issued as a result of any ongoing or recently completed OSHA investigations. Although there is no specific rule addressing COVID-19 or infectious diseases, there are other standards which OSHA could use as the basis of a violation. For instance, there are multiple standards related to personal protective equipment, eye and face protection, and respiratory protection. Additionally, employers are also required to comply with the General Duty Clause of the Occupational Safety and Health Act, which requires providing a place of employment that is free from recognized hazards that are causing or are likely to cause death or serious physical harm to employees. Employers should be mindful of and implement recommendations in OSHA's guidance on preparing workplaces for COVID-19 to ensure they satisfy the General Duty Clause and other compliance requirements. Next, OSHA recently updated its enforcement position related to record-keeping requirements, requiring all covered employers to record cases of COVID-19 if they meet all of the following 3 requirements. 1, it was an illness confirmed as COVID-19. 2, the illness is work-related as defined by 29 CFR 1904.5. And 3, it involves one or more of the general recording criteria in 29 CFR Part 1904.7, such as medical treatment beyond first aid or days away from work. To comply with this requirement, employers should make a reasonable assessment as to whether an incident is work-related. This assessment could include asking the employee about potential ways he or she contracted COVID-19 and reviewing the employee's work environment, especially if there is another confirmed COVID-19 case in the workplace. Moreover, a COVID-19 diagnosis is more likely to be work-related if there are multiple other infections in the workplace. If the employee had close contact with a confirmed case in the workplace, or if the employee's job duties include frequent exposure to the general public. A diagnosis is likely not to be work-related if the employee has close contact outside of work with an individual confirmed to have COVID-19. Altogether, this means that employers should be mindful of their record-keeping and reporting requirements and overall compliance duties. Just because your industry has not been subject to inspection or citation during the pandemic does not mean that it can't or won't happen. I will now turn it back over to Nicole to conclude with some practical guidance for employers to help protect their employees in the workplace and avoid scrutiny or actions by enforcement authorities.
Thank you, Melanie. In response to these enforcement risks, which are likely to increase as more businesses return to work, employers should consider preventive measures to minimize such risk and keep employees safe. Specifically, employers should consider the following. First, analyzing federal, state, and local guidelines frequently, if not daily. This includes OSHA, CDC, and other county or state health department guidelines. These are constantly changing and should be monitored and documented. Employers should consider adopting workplace health and safety practices and related procedure. This can include the use of personal protective equipment, such as masks or other equipment that may be necessary to keep employees safe on the job, employing social distancing practices by rearranging workspaces or eliminating the amount of personnel in a location. This can also include updating reopening plans and corresponding safety procedures that may be required or appropriate. This will usually be done in conjunction with analyzing the federal, state, and local guidelines and changing requirements. Employers should also consider monitoring workplaces for any evidence of COVID-19 infection clusters. Employers may need to institute additional safety measures, such as quarantining employees or temporary shutdowns to keep employees safe. Employees should also consider consulting with external and internal workplace safety experts regarding proper safety procedures for returning to work in a specific industry. Employers should also consider maintaining a record of COVID-19 related safety procedures, including the date of the implementation and any subsequent updates. This could include documenting any change in the workplace situation, the use and requirement of personal protective equipment, so the date that employees were required to wear masks at the location. Documentation is key. Employers should also consider regularly training and updating their employees on COVID-19 related safety procedures and keeping records of such training. Employers should consider developing a process for enforcing the COVID-19 related safety procedures. Once these procedures are developed, the employer will want to make sure that they have a process to ensure that these measures are implemented and appropriate enforcement is utilized. Employers should also consider developing an action plan for reevaluating all of these policies and procedures due to changing laws, guidelines, and knowledge about COVID transmission. Finally, employers may want to consider planning for potential future shutdowns. Depending on local, state, or federal requirements, a business may have no choice but to shut down and send their employees back home. Employers will want to consider what may happen and how they will handle such a situation. In conclusion, we hope that you found this podcast very helpful. We want to remind you that OSHA and other state and federal enforcement agency investigations related to COVID-19 are likely to continue and even increase as employees return to work and as additional COVID-19 clusters pop up. Thus, employers should be aware of their compliance obligations, including record-keeping requirements for work-related COVID-19 infections. Employees should also consider developing, implementing, and monitoring their measures to minimize the risk of such enforcement actions and creating a safe working environment for their employees. For more information on this topic, please see our article, Navigating Your Business Through a Shifting Enforcement Landscape, Practical Advice in the Time of COVID-19, Workplace Safety Enforcement. This can be found on the K&L Gates Hub at www.knlgateshub.com. We hope you enjoyed this episode of K&L Gates' Working Wise podcast series. More episodes in our series can be found at knlgateshub.com or search for our standalone Working Wise program. You can also learn more about the Labor, Employment, and Workplace Safety Practice Group on our main website at knlgates.com. Thank you for joining us, and we look forward to speaking with you next time.
Thanks again for listening to Working Wise. New episodes are available for download through iTunes, Google Play, and other podcast applications. If you have any topics you would like to hear about on the next Working Wise podcast, please send them to workingwise@klgates.com.